Welcome back to What Is, the show where we take the world's most confusing concepts and try and make sense of them before our coffee gets cold. Today, we're tumbling down a very specific, very strange rabbit hole. No, it's not an obsession with Victorian fashion or a sudden urge to host tea parties with rodents. We're talking about a real, documented, and utterly mind-bending neurological condition. Ladies and gentlemen, grab your shrinking potions, or maybe don't, as we explore what is Alice in Wonderland Syndrome. Imagine you're sitting on your sofa, scrolling through your phone. Everything is normal, and then suddenly it isn't. Your phone, which was just 5 inches from your face, now looks like it's 3 miles away. Your hands, they've grown to the size of giant hams. The television across the room is now the size of a postage stamp, and the cat walking across the rug looks like a prehistoric mega predator from the high-budget sci-fi movie. You aren't dreaming. You aren't necessarily on drugs. You're experiencing AIWS, Alice in Wonderland Syndrome. And while it sounds like a whimsical literary reference, for those living with it, it's very real, very disorientating glitch in the matrix. Technically known as Todd syndrome, AIWS is a neuropsychological condition that distorts perception. Note the word perception. This isn't a problem with your eyes are working just fine. It's a problem with the software in your brain that processes the signals those eyes are sending. In the medical world, this is called metamorphopsia. It's a fancy word basically meaning everything looks like it's melting or warping. There are 4 big hits when it comes to AIWS symptoms. First we have micropsia. This is where objects appear to be much smaller than they actually are. You might look at your car and think, I could probably fit that in my pocket. Then there's macropsia. This is the opposite. Your coffee mug might suddenly look like a 50-gallon drum. Good luck finishing that latte. Third is pelopsia. This is where objects seem to be much closer than they are. Imagine a wall suddenly looming an inch from your nose when it's actually 10 feet away. It's the jump scare of neurological symptoms. And finally, teleopsia, where things appear to be miles away. But wait, there's more. Because why stop at size and distance? AIWS can also mess with your sense of time. Some people report that time seems to be moving at double speed, like the world is stuck on fast forward. Others feel like they're moving through thick molasses. Some even experience Lilliputian hallucinations, which is a fancy way of saying they see tiny people or animals that aren't there. If you ever wanted to be Gulliver for a day, this is the syndrome for you. Except, it's actually quite terrifying when it happens without warning. So who discovered this, and why the name? Meet Dr. John Todd. In 1955, this British psychiatrist noticed a pattern amongst his patients, particularly those who suffered from severe migraines. They described these bizarre distortions in their body image and surroundings. Todd was a fan of literature, and he realized these descriptions matched almost perfectly with the experiences of Alice in Lewis Carroll's 1865 classic, Alice's Adventures in Wonderland. You remember the scene. Alice drinks from a bottle and shrinks. Then she eats cake and grows so large her head hits the ceiling. Medical historians have long theorized that Lewis Carroll, real name Charles Dodgson, suffered from AIWS himself. Carroll was a known migraine sufferer. His diaries contain descriptions of bilious headaches accompanied by odd visual events. Whether he was writing a fantasy novel or just journaling his Tuesday morning is still a matter of debate, but Dr. Todd saw a connection and the name stuck. It's much more catchy than cerebral dysmetropia, anyway. But what is actually happening inside the brain? Put simply, the brain's GPS is malfunctioning. Most researchers point towards the parietal lobe. This is the part of your brain responsible for processing sensory information and, crucially, spatial awareness. It's the part of you that knows where your hand ends and the air begins. In an AIWS episode, there is often an abnormal amount of electrical activity or a temporary lack of blood flow in these regions. The brain gets confused. It starts guessing. Is that a door? The brain asks. Or is it a tiny portal for ants? Let's go with ants. The most common trigger for this is migraines. About 15% of migraine sufferers experience some form of AIWS, often as an aura before the actual headache kicks in. It's like a very weird opening act for a very painful concert. However, migraines are not the only culprit. In children, the number one cause is actually the Epstein-Barr virus, more commonly known as the cause of mono or the kissing disease. For some reason, this virus can cause inflammation of the brain that triggers these Wonderland episodes. Other causes can include epilepsy, brain tumors, and the use of hallucinogenic drugs. But for many, especially kids, it just happens. Now, if you're listening to this and thinking, wait, I remember the hallway looking really long when I was 6, don't panic. You're not a medical anomaly. AIWS is significantly more common in children. Many people grow out of it as they reach their teens. It's thought that the brain matures, and as the neural pathways become more robust, the glitches stop happening. For kids, it can be a terrifying experience. Imagine being 5 years old and suddenly feeling like your head is the size of a beach ball. If you're a parent and your child describes these things looking weird or far away, don't assume they're being imaginative. They might be having a genuine Alice moment. So how do we fix it? The short answer is, you don't. At least not directly. There is no anti-Alice pill, because AIWS is a symptom, not a disease itself. Doctors treat the underlying cause. If it's a migraine, you treat the migraine. If it's a virus, you wait for the virus to clear. The good news is that AIWS episodes are usually brief. They last anywhere from a few minutes to half an hour. The best treatment is often just a dark room, a quiet environment, and a reminder that your hands are not, in fact, the size of watermelons. It will pass. Despite how bizarre it is, AIWS is actually a window into how incredible the human brain is. Think about it. Your entire reality, the size of your room, the distance of your screen, the speed of the clock, is just a best guess made by a 3-pound lump of grey tissue sitting in the dark inside your skull. When that tissue gets a little tired or a little sick, the world stops being objective and starts being suggestive. It reminds us that we don't see the world as it is. We see the world as our brain interprets it. And sometimes our brain wants to see the world of giants and miniatures. Alice in Wonderland Syndrome remains a relatively rare and somewhat mysterious condition, but it's a vital area of study for neurologists. Every time we map a distortion, we learn more about how the healthy brain maintains the illusion of a stable, consistent reality. So the next time you feel like the walls are closing in, literally, or you feel like a giant in a dollhouse, just remember your brain is having a little Lewis Carroll moment. Sit back, relax, and wait for the drink me potion to wear off. That's it for this episode of What Is. We hope that helped clear up one of the more curiouser conditions in the medical books. If you enjoyed this trip through the looking glass, do us a huge favour. Hit that like button, subscribe to the channel, and ring that bell so you never miss an exploration into the weird, the wonderful, and the what on earth is that. Have you ever experienced anything like Alice in Wonderland Syndrome? Or maybe you have a topic that you've always wanted us to dive into. Let us know in the comments below. We read them all, even the ones that look 3 miles away. Thanks for watching. We'll see you in the next one. Until then, Keep your head the right size, or try to anyway.